Hello, my name is David James Smith, MD. I'm the Medical Director of San Diego Comprehensive Pain Management Center and Pacific Surgical Institute, a fully licensed and accredited ambulatory surgical center here in Metro San Diego. We also have locations in El Centro, California and Chula Vista. I'm double board certified in physical medicine and rehabilitation and pain medicine with an emphasis on interventional pain medicine. I've been in practice now over 28 years, and we provide outpatient interventions to treat chronic pain. Some of the advances in the last 8 to 10 years have revolutionized the treatment of chronic pain and spinal disorders. Previously, many of these disorders had to be treated with hospitalizations and required months of rehabilitation. Current advances allow us now to treat these same conditions with outpatient procedures. This allows you to return to function quickly and to get out of pain faster. I hope you enjoyed this digital video library that we have created that shows some of the more exciting advances in interventional pain medicine. You can also visit us at SanDiegoPainCenter.com. Once again, I hope you enjoy these videos, and please feel free to contact us and check us out on social media as well. Thank you. This is a intra-articular hip injection with an arthrogram, and what I've done is I've marked the hip location under fluoroscopy. I do this from a lateral position. Many interventionists do it from an anterior position. By doing it laterally, I remove the femoral artery and femoral nerve from potential involvement, and so less risk is always better. So I've got a mark on the femoral head of the hip where the capsule is. I've marked it. I'm numbing the skin, and that's going to bite a little bit. But as you can see, I talk to the patient. I always talk to my patients and tell them what I'm doing. It's hard to see with the mask, but I'm telling the patient that this is going to sting a bit. But once done, you won't feel anything. So he's a little uncomfortable with that lidocaine going in there. I believe it's lidocaine, not Marcaine. Then I use a 22 gauge, 3.5 inch needle for most of these, except for larger patients. Then we use a 22 gauge, 5.5 inch. I've beveled the edge so I can steer the needle. This is one of the easiest things we do. Once I'm in the hip capsule, I use Omnipaque to create an arthrogram. And I believe we show an arthrogram at the end of this. And then I use Kenalog, Decadron, and Marcaine to inject within the hip. And once done, the patient should get significant relief. And there is the arthrogram in the hip going around the capsule and filling the entire hip joint. And that is an intra-articular hip injection with